Greetings, everybody. My name is Dr. Qinisile Diale, commonly known as Dr. Q. I'm an obstetrician, gynecologist, and fertility specialist practicing at Family Matters Fertility Center in South Africa, Pretoria. So today I'm going to be discussing a topic: safely trying to conceive with HIV. Now, this has been a very controversial issue in the past years as the lifespan of HIV positive individuals was shortened by the disease, and there were concerns of offspring that would be born with HIV infection and lead a life of being parentless due to the demise of parents from the disease. And it had gone into even extents where people were sterilized the moment HIV diagnosis was made on them, and they would lose their hopes into future family building. So today we bring the topic to the fore, and we would like to discuss with you the safe ways of trying to conceive when a patient has been diagnosed with HIV. What options are there and what can be done? And the main aim would be to keep yourself protected and safe, to keep your partner protected and safe, and also to prevent the transmission of HIV to the offspring. So in South Africa, estimates are that about 18% of the population of ages 15 to 49 are actually HIV positive. Now, if you look at this age group, 15 to 49, that is the reproductive age group. So it means that these people are at their peak of their lives, of their careers, and at the times that they would like to actually be able to start families. Now, when they are diagnosed with HIV, what options and what hopes are there for them? So couples, maybe we can start by asking, how does HIV really have an effect on fertility, if any effect on fertility? So how does HIV actually affect a person's fertility? Now, there are many ways that HIV can affect fertility. HIV does not affect the body only physically, but it also mentally affects individuals, and also that social stigma that is associated with HIV also has a bearing on the patient's health. Now, HIV physically affects the immune system of the individual. It results in loss of appetite. It results in stress and weight loss. And all these things can have an effect on a woman in terms of her ovulation, and it can result in a woman also even missing her periods or not having her periods at all. And we know that menstruation or ovulation is actually necessary for conception. So a woman can be affected in that way. And for males, you find that all these factors then lead to a male having a poor production of sperm. So the sperm's quality and quantity can be affected, resulting in difficulty in conceiving. And again, HIV has other associated STIs or opportunistic infections that can affect individuals, and HIV infected patients can have STIs like chlamydia and gonorrhea that can go on to affect the reproductive system. And in females, this can go on to damage the fallopian tubes, where you find that the fallopian tubes even end up being blocked. The fallopian tubes can have fluid collection, which is what we call hydrosalpinx, and even have pus collection, and eventually also affect the ovaries, which is the storage house of the eggs, the hub of fertility, where biological children are concerned. So that is one of the ways that HIV can actually affect fertility in women. Now, it can also go on to affect individuals psychologically, where they have feelings of guilt and shame, where they are afraid of actually transmitting the virus either to their partners or to their offspring. Therefore, they avoid any interactions or any even attempts to try and build up a family. And they can also be affected socially, where they can have financial problems due to HIV and the social norms and stigmas and the understanding that HIV positive people cannot actually be expected to reproduce, and also just limited knowledge surrounding the topic itself. So when we look at couples that are HIV infected, they can either be a couple where one partner is infected. Now, that is what we call a sero-different couple, where only one partner is infected and the other partner is HIV negative. Or you can have what we call a seroconcordant couple, where both partners are affected or infected by HIV, seroconcordant. Now, the way that we approach trying to conceive for these couples is different. And the most difficult one is where the couple is sero-different. Only one partner is infected with HIV, and we are trying to protect the other partner by keeping them HIV negative and also protect the offspring. Again, the couples may be infected with HIV, but have no fertility issues, meaning their reproductive systems are fine and their hormones and all that. The only concern they have is the transmission of HIV, either to the partner or the offspring. And then you have couples that are HIV infected and also have associated fertility problems, where you find that maybe there's poor sperm quality and quantity in the male, or there is also other reproductive issues in the female, like ovulatory problems or blocked tubes and so on. So now we're going to look at what options are there to actually reduce the risk of transmission to the partner and to the offspring in couples that are HIV infected. So number one, first and foremost, it is very important to investigate and treat all forms of sexually transmitted infections. Just this alone can reduce the risk of transmission of HIV by 40%. Again, male circumcision has been associated with a 66% reduction in the transmission of HIV to your partner. And for a couple that is sero-different, where only one partner is infected, the partner that is HIV negative, that is not infected with HIV, can actually go on what we call pre-exposure prophylaxis. These are antiretroviral drugs or treatment that are taken by individuals who are trying to protect themselves from being infected by an HIV positive partner. So patients during the time of trying to conceive can actually go on pre-exposure prophylaxis, where they take ARVs themselves until the time of conception, and then they can decide whether they go on a protected or condom usage, protected intercourse or condom usage. Again, there's an option of actually just the HIV infected partner going on what we call highly active antiretroviral therapy. So those are antiretrovirals or ARVs in short. So that has been shown to have a more than 96% reduction in HIV infection, especially if the individual that is HIV positive is compliant on the treatment and remains virally suppressed, meaning they have less than 50 copies per mil of the virus in their body that is detected on a blood sample. Now, if a woman is HIV positive and the partner is HIV negative, the option of vaginal self-insemination, where a woman is able to collect the semen from sexual intercourse through a condom from the HIV negative male and self-inseminate herself, where she can even use a syringe from the through the condom, collect and inseminate herself with the semen, that has been associated with 100% reduction of HIV infection, and that is for a female that is HIV positive, HIV negative partner, and she doesn't have any other fertility issues, meaning her ovulation is fine, her fallopian tubes are patent and normal, and she times the time of her ovulation. Then she just collects the sperm and injects it into herself. Another way of actually reducing HIV infection to the partner is making sure that the HIV positive partner is on ARVs, and then only during the time, and is virally suppressed, and only during the time of high fertility, then, or peak of fertility, or during the time of ovulation, then couples can have condomless intercourse. So if the couple is virally suppressed, that has been shown to also have 100% risk reduction for HIV transmission. Okay, and then should there be a concern or fear of having condomless intercourse with a virally suppressed individual, then the couple has an option of actually washing the sperm. If the male is HIV infected, they can go for a sperm wash in a fertility center, and then the sperm is freed of the cells that are containing the virus. Then only virally free sperm confirmed by the lab can actually be inseminated into the woman, and this is through intrauterine insemination, sperm wash with intrauterine insemination. And for couples that have other fertility issues like ovulation problems or poor sperm quality and quantity or blocked tubes, then the options of in vitro fertilization stand for them, where they can go to a fertility center and the sperm be washed and IVF be done, or intracytoplasmic sperm injection, which we call ICSI, can also be done on the sperm, on the sperm and the egg being fertilized in the lab, and the embryo being inserted into the woman. Now, a study was published in 2016 called Partner Study, where couples that were virally suppressed on HEART for more than 4 months with less than 50 copies of the virus in their bloodstream were tested with their HIV negative partners, and it was found, and they had a condomless intercourse, and it was found that there was zero transmission rate of the HIV virus to the HIV negative partner if the HIV positive partner was compliant on the medication and virally suppressed. Now, this led to the concept called U equals U, which stands for undetectable equals to untransmissible, or undetectable equals to uninfectious, meaning a couple that has an HIV positive partner who is compliant on their HEART or ARVs and is completely virally suppressed can have unprotected or condomless intercourse and have a high reduction on the risk of HIV transmission. So studies have shown that there has been zero transmission rate in those couples. So for couples that are still concerned and still have fears, there are options. So the most difficult couple is that which we call sero-different or sero-discordant couple, where one partner is HIV positive and the other is not. So starting with an example of a male partner being HIV positive. Now, number one, we need to confirm that the female is still HIV negative, and two, we need to confirm that the male is virally suppressed. Now, should there be no other fertility issues, this couple can be advised to have untimed condomless sexual intercourse, meaning they can have a condomless intercourse even regardless of the time of ovulation. And if the male is HIV positive and the female is HIV negative, then the female can be put on pre-exposure prophylaxis as an option as well, and she can take this treatment and they can have a timed sexual intercourse during the time of ovulation for the lady. And again, the option of washing the sperm and then inseminating the sperm into the lady is viable, and this comes at a certain cost, and it's done in fertility centers where a sperm wash is an option, and then the lady can be inseminated if she's concerned about viral transmission. And other options like intrauterine insemination, in vitro fertilization, and ICSI is are available for patients that have, or males that are HIV infected and have other fertility issues with poor sperm quality or quantity. Now, if a female is HIV positive and the male is HIV negative, first and foremost, we need to confirm that the male is still HIV negative. Number two, we need to confirm that the female is virally suppressed. Then from there, an option is that they can have untimed sexual intercourse because U equals U. There is an expected non-infection to the HIV negative partner if the HIV positive partner is virally suppressed, or they can have condomless intercourse only during the time of ovulation for the lady, especially if the lady is HIV positive on antiretrovirals and virally suppressed. And again, the woman can then consider just taking the HIV negative partner's sperm and doing self-insemination, vaginal self-insemination with the sperm, or the HIV positive, HIV negative male can go on pre-exposure prophylaxis where he takes ARVs to protect himself from HIV infection. And then should there be further concern or worries and you say, look, we don't want to take any risk, we just want to be sure and certain and all that, then the couple has an option of then going for intrauterine insemination where the sperm of the HIV negative male in the fertility lab is taken and inserted into the lady during the time of ovulation, which is intrauterine insemination. And if there are other fertility concerns or issues like blocked tubes or poor sperm quality or any other ovulatory issues and so on, or hormonal issues, then treatments with IVF or ICSI are options as well, and this comes at their own cost. So in short, the fundamental concepts of actually safe conception when partners have got HIV is: number one, know your own status; two, know your partner's status; three, get your partner to be on ARVs, and make sure that you wait until the partner is virally suppressed, and then we can look as to what options are there from the list that I've discussed above, and is it a male or a female? Are there any other fertility issues that are of concern? And then you're welcome to visit your nearest fertility center for further interventions and guidance in your way to trying to conceive with HIV. But in the end, it is good to know that we've had very good outcomes. We've had many offspring that are actually born HIV free from couples that are HIV positive. So the journey can be a happy one and a safe one. Thank you.